Hi, my name is Dani DiCarlo, and for my ANSAC 415 current events paper, I did mine over the West Nile virus in horses. So what would you do if you walked out into your pasture and saw your horse struggling to get up from the ground? You would be pretty concerned, and you've thought back in the past couple days and have noticed that your horse has had a little bit less of an appetite, has been wandering around away from the herd, a little more lethargic. If he's struggling to get up from the ground, he's definitely showing weakness in his legs. You check his temperature and he's running a fever. Any of these symptoms, along with muscle tremors and ataxia, you start to get pretty concerned, so you call your veterinarian. Well, your vet sees these symptoms and has West Nile virus as a pretty big concern on her list. Therefore, you draw your horse's blood sample, spin it down, pull off the serum of the blood sample, and send it to the USDA. There at the USDA, they do a comparative ELISA test using the blood serum. It's an immunological test that will show you if your horse has an antibody response to the virus antibodies. Well, you get your results back and you realize, yes, your horse is testing positive for a response to the West Nile virus. Therefore, you learn from your veterinarian that the only thing you can do for your horse, it looks like he's in extreme pain, is supportive veterinary care. There is no set treatment or cure for this disease, and the supportive veterinary care is they give the horses antiviral medication, which may or may not help. They supply excessive fluids to the horse continuously. A lot of horses have to be put in harnesses or supports as shown in the picture because they can't stand on their own because their muscles are so weak. Sometimes the horses can't even feed themselves, therefore they have stomach tubes put in, and sometimes even catheters for release of pressure. In a study by the Texas A&M, they said these horses couldn't even do anything on their own. They pretty much had to do everything for them. So you're pretty torn up about this, and you realize that could you have prevented this? And the answer is definitely yes. These horses rely on you for care, and they are constantly exposed to the outdoors, therefore constantly exposed to mosquitoes. So preventing this disease and the transmission of this disease is incredibly important. Some things you could do to prevent are using mosquito sprays and animal-safe mosquito bombs. These help block mosquitoes from penetrating your animal's skin. Also, mosquitoes breed and live and rest in standing water. Therefore, removal of all standing water is incredibly important. Make sure you turn over all wheelbarrows, all buckets, any standing water on the ground. Figure out how to get rid of it. Another thing you can do is make sure if you have a water trough that you clean it out frequently, or you can use microbes or fish that eat mosquito larvae that are in the water. And one of the most important steps of this is vaccination for West Nile disease. So the West Nile vaccine is made from a lot of different companies. Each of them have a huge success rate. A couple of them that provide these vaccines are the West Nile Innovator from Zoetis, and Merck has their own brand as well. The vaccine is about a 6-month vaccine. It's dependent on the susceptibility of the horse that you're giving the vaccine to. A lot of people say for us in our area to vaccinate your horse in the early spring before peak mosquito season comes around. Older horses are most susceptible to the virus, therefore make sure you get horses who are over 15 are a lot more important. The vaccine is also fairly cheap, about $25 per dose with about any brand. So the vaccine itself has been proven to be very effective. In 2002, the West Nile virus vaccines lowered the affected rate of horses by 70% in that year. Shown to be a 96.7% effective against a 2003 outbreak among horses, which was the peak year for West Nile virus. In 2002, among 1,478 horses, cost of the treatment was $1.26 million versus cost of vaccination was $74,000. So as you can see, it's very cost effective because it is very expensive to take care of a horse with supportive therapy. So in conclusion, the main idea is to make sure you vaccinate your horses. As the owner, your job is to take care of your horses for their health and for their safety. And if you don't take these measures, it's going to cost you a lot of money and it'll cost your horse its life. Thank you.